Hello, my name is Yassin Naga. I'm the internal medicine chief resident at the University of South Florida. We have conducted a study titled Single-incision needle knife biopsy for the diagnosis of gastrointestinal subepithelial tumors, a systematic review and meta-analysis. The corresponding author for this paper is Dr. Douglas Adler. First of all, I would like to thank GIE for publishing our paper. The reason we felt this was an important study to perform is that a subset of subepithelial tumors can be malignant tumors, such as GI stromal tumors. Endoscopic ultrasound is the current modality of choice to evaluate the characteristics of these subepithelial tumors, such as the tumor size, margins, and wall layer of origin, which can assist in differentiating between benign and malignant lesions. However, the management of subepithelial tumors frequently depends on the underlying precise histopathological diagnosis. Unfortunately, biopsies of subepithelial tumors remain challenging, as they can often appear histopathologically normal if only the surface mucosa is sampled. The two most commonly used methods for tissue sampling currently are endoscopic ultrasound-guided fine needle aspiration and endoscopic ultrasound-guided fine needle biopsy, which have demonstrated suboptimal diagnostic yields, which have ranged significantly from study to study from around 74.5% to 92%. For this reason, we wanted to look at a newer diagnostic method, which is endoscopic ultrasound-guided single-incision needle knife biopsy. This procedure involves creating a 6 to 12 millimeter linear mucosal incision with a conventional needle knife, followed by obtaining tissue samples by forceps biopsies. The initial study that looked at this procedure is by De La Serna, Higuera et al., and it reported a diagnostic yield of 92.8% from only 14 cases. Since then, there have been several other studies with larger sample sizes that evaluated the effectiveness of single-incision needle knife biopsy. The primary outcomes assessed in our study were the technical success and diagnostic success of single-incision needle knife biopsy in gastrointestinal subepithelial tumors. The secondary outcomes assessed were the overall procedural-related adverse events and whether immunohistochemistry could be successfully performed in the samples obtained by single-incision needle knife biopsy. What we found was single-incision needle knife biopsy is a technically successful procedure. It's thought that the improved tissue acquisition improves the diagnostic success. In addition, the ability of single-incision needle knife biopsy provide enough tissue to perform immunohistochemistry staining also improves its diagnostic potential. We found that the diagnostic success of single-incision needle knife biopsy in our meta-analysis was 87.9%. Single-incision needle knife biopsy appears to be a safe diagnostic procedure with a low rate of adverse events. The most common adverse event was bleeding following the incision. However, this was frequently self-limiting or resolved with endoscopic management. Overall, single-incision needle knife biopsy is a viable alternative that can improve the diagnostic success of gastrointestinal subepithelial tumors, especially in the setting when endoscopic ultrasound-guided fine needle aspiration or endoscopic ultrasound-guided fine needle biopsy fails to provide a definitive diagnosis. Moving forward, more randomized, large-scale controlled trials with direct comparison to endoscopic ultrasound fine needle aspiration and endoscopic ultrasound-guided fine needle biopsy are needed to further evaluate the success of single-incision needle knife biopsy. I'd like to thank you for your time, and if you'd like to review the full article, please go to the GIE website.